Then a more recent study published in 2018. You can see here a fairly large sample size. Those in the control group, about 52, and then in the high intensity resistance training group, 49. So they were all middle to older age. And looking at their bone mineral density scores, this is at the lumbar spine and the femoral neck, and you see the T-scores here for the lumbar spine and the femoral neck. So going back to the previous video, we talked about these T-scores and the importance of these T-scores to diagnose low bone mass. So for these women here in this study, the T-score of negative 2.1 or negative 1.9 would be indicative of osteopenia. So in terms of the high intensity resistance training protocol, the resistance exercises that were used here include the deadlift, the overhead press, and the back squat. These were performed 2 days per week for 8 months and performed 5 sets of 5 reps at 80 to 85% of their tested 1RM. And they also applied what they called impact loading. That was applied via jumping chin-ups and then dropping to the floor to really apply that impact to the lower body skeleton. And then the control group performed a home-based, low-intensity program designed to improve balance and stability. So the main outcome in this study was changes in bone mineral density. So we see here in the lumbar spine and the femoral neck, in the control group, there was actually a slight decrease over the course of 8 months in bone mineral density in the control subjects. However, in the high intensity resistance training group, a significant increase here in the change score in terms of lumbar spine bone mineral density, almost a 3% increase. However, there was no significant change in the femoral neck bone mineral density in these women. But overall, these change scores here were significantly different compared to the change scores in the control subjects. So again, just highlighting that longer-term resistance training programs result in significant increases in bone mineral density in older adults. So in terms of program design considerations for older adults, we know that both aerobic exercise and resistance exercise training are recognized as important components of a well-rounded fitness program for older adults. However, the fundamental principles of designing a resistance training program for an older person and a younger person are basically the same, but there are several concerns that strength and conditioning professionals need to be aware of when working with older adults. So these same fundamental principles of resistance training are going to apply to both young and older adults. Again, going through the resistance training program design variables. And importantly here for older adults would be to perform a comprehensive needs analysis prior to moving on to the other variables here that make up the program design. So before starting a resistance training program, attention should be given to pre-existing medical ailments, prior training history, as well as perhaps nutritional status that may predispose older adults to increased risk of exercise-induced injury or illness. So after this information has been obtained, a pre-program evaluation to document baseline measurements and assess responses to specific exercise modalities should be performed. Now, a strength test, preferably on the equipment used in training, should be performed to assess responses to resistance exercise as well as to aid in exercise prescription. So just like we did with younger adults talking about resistance training periodization, in older adults it's also important to alter volume and intensity throughout the year to prevent overtraining from occurring and to ensure that continued progress is made. So if we look at exercise training guidelines from older adults, and these guidelines come from the American College of Sports Medicine and the National Strength and Conditioning Association. So we look at aerobic training first, looking at frequency, time, and intensity. So many of us are familiar with the aerobic training guidelines. We see that these recommendations here match up very well with healthy younger adults. So 5 or more days per week of moderate intensity, or 3 or more days per week of vigorous intensity of aerobic exercise. In terms of the time, for moderate intensity, 30 to 60 minutes per session, vigorous intensity, 20 to 30 minutes per session. However, these bouts of exercise can be accumulated over the course of the day in bouts of 10 minutes or even fewer, according to recent evidence. Again, accumulating bouts of exercise over time to meet the recommended guidelines. So when we talk about per week, in terms of total aerobic activity, recommendations are 150 to 300 minutes per week of moderate intensity, or 75 to 150 minutes per week of vigorous intensity. And intensity for aerobic exercise, as we've talked about, is typically prescribed as heart rate reserve. So for moderate intensity, it's typically about 40 to less than 60% of heart rate reserve, or an RPE on a 1 to 10 point scale of 5 to 6. For vigorous intensity, a little bit higher in terms of heart rate reserve, maybe upwards of greater than 60 to 90% of heart rate reserve, corresponding to an RPE of 7 to 8. Now looking at resistance training guidelines for older adults. So while resistance machines may be used in the early stages of a training program with older adults due to balance as well as flexibility limitations, where appropriate, older adults should use free weight, multi-joint resistance training exercises, which provide a greater overall training stimulus and place a greater demand on postural stability. So untrained older adults who begin a resistance training program should start at a relatively low intensity and volume, and the exercise prescription should be individualized. So if we talk about the intensity here, defined as resistance or load, for those beginning a resistance training program, you would have them start kind of the lower end, maybe 40 to 60% of their 1RM, and then over time progress to a higher intensity. And in terms of the volume, in terms of sets or reps, perhaps have them begin with one set at about 10 to 15 reps, and then progress to add more sets as desired, or progress to fewer reps with heavier loads. Now, the early phase of the training program should be directed towards learning proper exercise technique while minimizing the potential for muscle soreness and injury. Now, following the initial adaptation period, typically 4 to 6 weeks in duration, the training program can gradually progress, provided that it continues to meet the needs and medical concerns of each person. And once participants master the performance of basic resistance exercises, more advanced and demanding exercises, such as standing postures with free weights, multi-directional medicine ball exercises, and advanced balance training can be incorporated into the program. So the resistance training program should vary in volume and intensity throughout the year, as we talked about, and the goal here is to prevent overtraining and ensure that progress is made. So I wanted to highlight the picture that you see here. This year, in 2019, the National Strength and Conditioning Association came out with a position statement regarding resistance training for older adults. This is based upon the most recent scientific evidence. So we've talked about some of the health benefits of resistance exercise for older adults. Here it's highlighting here a number of physiological adaptations as well as functional benefits of resistance training for older adults. In terms of the suggested resistance training program parameters, you see that here in the middle. In terms of frequency, exercise choice as well as sets, number of reps per set, the intensity, again typically prescribed as percent of 1RM. You also may include power exercises or explosive exercises in the programs of older adults, assuming that they can demonstrate proper technique. And just like we would for young adults, we want to follow the principles of individualization, periodization, as well as progression. Some important notes and considerations that you see over here would be properly designing the resistance training program with making sure appropriate exercise technique is used and proper spotting is used in order to ensure safety of the older adults performing the exercises. It's also important to note that programs can be easily adapted for those with frailty, mobility limitations, cognitive impairment, or other chronic conditions, and even those residing in assisted living and skilled nursing facilities. And finally, in terms of another consideration, all resistance exercise programs should correspond with the specific individual needs and capabilities of each older adult. And participation in such programs is unquestionably beneficial for older adults. So wrapping up this topic, as we've talked about, resistance exercise is a safe and effective method of conditioning for males and females of all ages and abilities. The potential benefits are multifactorial, including positive effects on a variety of physical performance variables and health markers. Moreover, regular participation in a resistance training program can reduce the risk of sport and physical activity related injuries and promote independent living in older adults. And as I highlighted, though the fundamental principles of exercise training are similar for people of both sexes and all ages, there are unique considerations specific to each population. So therefore, by having a basic knowledge of age and sex-related differences, that's going to be essential to the development and evaluation of safe and effective exercise training programs.